So it's been such an honor to be here in Yokohama to represent ASCO at this important meeting. The JSCO team has just done a phenomenal job putting this meeting together, and it's been very important for JSCO and ASCO to have the opportunity to put on display all the collaborative work that we're doing together. So there have been 3 joint JSCO-ASCO sessions. One was reviewing the important data from our annual meeting in GI and GU malignancies. Another was focused on ctDNA, and a third on antibody-drug conjugates. And then this morning we heard just wonderful presentations by the young Japanese oncologists who are part of the ASCO JSCO Fellowship. So it's been a really inspiring meeting that's really demonstrated the importance of the collaboration between JSCO and ASCO. Yeah, so we'll be meeting again in Chicago for our annual meeting at the end of May, beginning of June 2026. And my dear friend and colleague, Dr. Eric Small, who's a current ASCO president, will be presiding over that meeting. And Dr. Small's theme is the science and translation of medicine. And particularly in the U.S. right now, I think it's important that his message is loud and clear that science matters. I think equally important is Dr. Small's absolute commitment to global oncology and the importance of translation of science to the benefit of patients throughout the world. I think those who attend the meeting will really feel the passion that Dr. Small has for global oncology and the translation of the science both in the U.S. as well as globally, with an emphasis on our colleagues who are from under-resourced areas, and that includes under-resourced countries as well as in the U.S. under-resourced counties. So I think it's going to be a real celebration of the global impact of cancer care, and I encourage our ASCO members from out the world to come, particularly our friends from China. We really appreciate the growing number of Chinese investigators who are submitting their work in the form of abstracts for consideration for presentation at our annual meeting, as well as their presence at the annual meeting, where their participation and questions really add to the robustness of the conversation. Yeah, so our relationship with JSCO is important to ASCO. It's one of our priorities, as are our relationships with a number of professional societies in the Asia-Pacific region. So I think the opportunity between ASCO and the Chinese Society of Clinical Oncology is to further some of our collaborative efforts, which we can do through things such as ASCO's Regional Council in the Asia-Pacific region. This is an opportunity for ASCO to hear from Chinese oncologists, members of the Chinese Society of Clinical Oncology. What are the most pressing needs for delivering cancer care in your region, and how can ASCO help to address those needs? I think another opportunity is, as I kind of alluded to with a previous response, for Chinese investigators to continue submitting their work for presentation at our meetings. I mentioned previously the annual meeting, which will occur in Chicago, but I'd also highlight our breakthrough meeting. So our breakthrough meeting is going to occur in June of 2026, towards the end of the month, so about 3 weeks after the annual meeting. It'll be in Singapore, and there'll be a call for abstracts that will open in early December, and we would be so excited to have work from our Chinese colleagues presented at that meeting.